Grand Pacific Health is a not-for-profit primary healthcare organisation providing locally tailored, high-quality services. Services focus on physical health, mental health, youth health, Aboriginal health and chronic disease management. Grand Pacific Health covers a large portion of southeastern New South Wales, including Headspace centres and GP clinics. Grand Pacific Health's vision is for equitable healthcare, where access to affordable, quality and culturally appropriate health services does not depend on where you live or your background. CEO Ron De Jong says the organisation is made up of more than 250 staff from clinical and non-clinical backgrounds who deliver world-class service.
Two things that make us really, really unique, and one that is the engagement of our staff. The other one is without a doubt our commitment to rigorous clinical governance. We are at core a clinical service delivery. Yes, we also do psychosocial support measures and care coordination, but all of that is wrapped up and supported by a rigorous, evidence-based governance of clinical service delivery and quality.
Grand Pacific Health delivers a wide range of programs across its key focus areas, designed to meet the needs of regional communities. Details of these programs can be found on the Grand Pacific Health website, gph.org.au. Consumers are invited to have their say on these programs in a number of ways within the organisation, through surveys, carer and consumer forums, youth reference groups and other advisory groups that inform service delivery. Youth Mental Health Manager Jenny Valdivia says Grand Pacific Health has a proven track record of co-design.
Youth reference groups are a really important part of the Headspace model. So we can't say that we're providing a really good youth-friendly service if we don't have input from the young people who are accessing our services or young people in our communities. So our youth reference group guide everything that we do within Headspace.
Executive Manager Mental Health Rebecca Singh says consumer engagement is an important strength of the organisation.
I think that the thing that is really unusual about us is that we're a kind of combination of being really rooted in the community and being very strong on our consumer-led values, but we also combine that with clinical rigour and being very serious about the science and the evidence base of what we do.
GPH is a service delivery organisation that prides itself on supporting some of our community's most vulnerable people. Headspace Goulburn Youth Reference Group member Emma says GPH and Headspace are an important part of her community.
The counsellors are all really friendly, really personable. It's like coming in to have a chat with a friend as opposed to a clinical environment. It's not that at all. So I think it helps young people feel very comfortable, very safe.
GPH is committed to embracing diversity and eliminating discrimination, welcoming all people irrespective of age, ethnicity, sexual orientation, faith, gender identity or socioeconomic status. GPH is proud to have developed and launched an organisation-wide reconciliation action plan to close the gap in Indigenous health, employment and education with measurable actions. While GPH is always looking for opportunities to improve and increase service delivery, CEO Ron De Jong says GPH is committed to maintaining a regional focus.
Wherever you live, you have access to affordable, quality and culturally appropriate health services and support in a timely manner. So that's what we provide. We want equity in health and we support that through primary healthcare services and supports in regional areas.
For more information about Grand Pacific Health, visit gph.org.au or follow us on social media.